Weller. Welcome to Your Health. Today, we're at the Hampton University Proton Therapy Institute in Hampton, Virginia, where we're going to learn what makes proton therapy so powerful in the battle against cancer. Set your DVRs because this is great information you'll want to have and share.
One of the most devastating things that someone can ever hear is that they've been diagnosed with cancer. This indiscriminate disease affects people of all ages, races, genders, and from all walks of life. And because of its nature, it not only affects the individual, but takes a tremendous toll on their family. Here at the Hampton University Proton Therapy Institute, also known as HUPTI, the highly specialized medical staff use the most cutting-edge technology to aggressively treat malignancies with incredible results.
Hampton University Proton Therapy Institute opened its doors and started treating its first patient on September of 2010. We have welcomed over 2,500 patients since we treated our first patient. All the various types of cancers that may be a candidate for radiation therapy treatment, they are a good candidate for proton radiation therapy.
Proton therapy is a form of radiation that uses protons or particles, charged particles, to treat tumors instead of using X-ray therapy, which is the much more common form of therapy. It uses a fundamentally different physics principle to treat these patients with tumors. So unlike an X-ray, we can actually control this beam and stop this beam where we wish to treat it. So that boils down to a savings of approximately 70% of normal tissue that does not need to be unnecessarily irradiated.
I don't believe that when we opened there was a resistance in the medical community towards proton therapy. However, it was clear that we were the new kid on the block and people didn't know much about it. Not only the patients didn't know about the choice of proton radiation therapy, but also medical professionals, which may be surprising, but they were not familiar with this option for treatment. So it took a lot of patient outreach and patient education from our side, as well as educating our colleagues how this unique tool may be different and advantageous to their patients.
The growth of centers reflects the recognition and realization by medical professionals and hospitals that this is a very viable alternative to conventional therapy. This is a very large proton therapy institute. It's the largest freestanding proton therapy institute in the world. We have 5 treatment rooms, I believe 98,000 square feet, so there is ample capacity here for the treatment. It is not an inpatient service as a rule. Patients are healthy enough that they're able to feed themselves, take care of themselves, often with family support at home, and come here every day for a relatively short period of time. But it is an outpatient service, and the patients are generally quite well during the therapy.
Hampton University Proton Therapy Institute is a very unique resource for our patients to access types of treatments that may not be available anywhere else, either in the state or even in the country. We have a very unique technology that we can use to patients' advantage to minimize the side effects that are oftentimes unavoidable with any other forms of treatment. And we can minimize those side effects, sometimes eliminate them. Reduction of the side effects, improvement of the patient's quality of life is where proton therapy thrives, is how we are better and arguably the best for a lot of patients.
It's exciting to learn we have more hope in the battle against cancer in the form of proton therapy. But how exactly does it work? Let's check out the science behind it.
Proton radiation therapy uses tiny particles that are called protons. Protons are some of the building blocks of nature. They are small, positively charged particles that carry some mass. As those particles interact with the matter, they deposit energy just like X-rays do. However, the way protons deposit energy is different from the way X-rays deposit their energy. Protons deposit very little energy as they are traveling at the entrance to the body because they are very energetic. They don't interact much.
Now the machine accelerates this proton in an ever-widening circle, hence the word cyclotron, until it achieves a speed of approximately 70% that of the speed of light. When it goes this fast, we have to let it out of the machine, and in the old days we used to irradiate nuclei and make isotopes. But in our case, we're irradiating the patient. Now because you and I are 2/3 water, water has electrons, and electrons are negatively charged. And so we can control the range of the proton by giving it differing amounts of energy to control it as it passes through the water molecules of your body.
Protons are also characterized by a so-called phenomena called Bragg peak. What Bragg peak is, it's a burst of protons' entire energy and deposition in a spot at 100%. So what this means that there is no exit dose. So ideally, if you think about it, that's what you want. You want very little dose deposited on the way to the tumor site, because you are traveling potentially through a healthy tissue, critical organs, while you are trying to get to the tumor to deposit energy to kill the tumor cells. And then there is no need to deposit the healthy tissue afterwards. So it is, in a way, an ideal technical tool to deposit energy to deep-seated tumors.
So this is a block of lucite. It is the same density of electrons that you and I as humans have in our bodies. So what's happening in this plastic is exactly what's happening in us. So this is the precision of the beam is not only in the X and the Y direction, but also in the Z direction, the depth of control. And that is what is unique to particle therapy, and in particular proton therapy. This block is a demonstration of that, and I like to show this to my patients, actually, oftentimes overlaying it on their tumors, their MRIs, so that they can actually see how the treatment planning will be achieved, and this is a very accurate representation of it here.
So at the end of the day, what it means for a patient, that you are able to spare the healthy tissues around the tumor.
Each appointment lasts around 30 minutes, but the actual time for the proton beam to be delivered is only about 2 minutes. Now we know what the machines do, but what is the patient experience like? We'll find out when we get back. Stay tuned. We're back at the Hampton University Proton Therapy Institute. It's one of a handful of facilities that uses cutting-edge technology to treat cancer with incredible results. We've already learned about the mechanics of proton therapy, but does it treat every type of cancer?
Historically, proton therapy has been used to treat brain tumors, pediatric tumors, and advanced head and neck and spinal cord tumors. These were the tumors that have been used at Harvard and in Europe and in the Far East for many years to be treated. But recently we've stepped out and are now treating lung tumors, breast cancer, prostate cancer, and quite successfully lymphomas now with proton therapy.
Proton radiation does not treat leukemia. The disease of leukemia is not targeted and localized to one area of the body. It's systemic throughout the whole entire body. We focus on diseases that are contained in one area that we can better target and treat. We work a lot with children in their growing spurts. We do not want to irradiate anything that's going to stun their growth. So the radiation beam is able to enter the body, directly affect the tumor, and not affect anything beyond the other side of the tumor.
Proton therapy is very effective, but like all therapies, the effectiveness depends upon the type of tumor. Generally, if you give enough radiation, you can kill the tumor, and for good. And good examples of this are sarcomas, soft tissue tumors of the spine and the tissues around the spine, and in the back. My chairman at Harvard, Dr. Soot, made his career on the treatment of these large tumors that were previously thought to be radiation insensitive. But he proved that this was not the case. We were simply not giving enough radiation to kill the tumors. Proton therapy can treat the patient's tissue behind the bowel, which is the limiting factor in this case, and not give any radiation to the bowel. And suddenly these tumors went from incurable to cure rates of 70 to 80%.
Proton therapy is really great at treating patients who have had multiple cases of tumors. First course of treatment, second course of treatment, third courses of treatment, because parts of the body can only receive so much radiation before it has complications. So once a patient has had traditional radiation therapy, a lot of oncologists will say, there's nothing else we can do for you. The areas around your tumor have received so much radiation dose. We do not want to cause harm to you. So those type of patients that can then come to the Hampton University Proton Therapy Institute to receive additional radiation, because the proton beam is a stopping power. We can treat the tumor and save everything beyond the tumor that has already been irradiated in the past. The ultimate goal for every patient is to totally eradicate and eliminate the tumor. Depending on the stages of some patients' diseases, we are only able to give them a better quality of life, but we do everything that we can to do the best for the patient.
If you or someone you know have been diagnosed with these types of cancers, make sure you ask your doctor for a referral. Now, cancer is intimidating, but treatment doesn't have to be. So what can a prospective HUPTY patient expect? Let's ask the experts.
The patient, once they've determined that they have cancer, they usually have a lot of workup tests to help focus and localize the disease. The patient will come here, review with the doctor all of the exams. The doctor will then come in here and draw the tumor where the radiation will be administered. In dosimetry, what we do is we determine where the radiation will enter the patient's body. What we create in here will be what happens every day for the duration of the patient's treatment. The way they're lying down, the type of materials that we use. We are their benchmark for what will happen over the course of their treatment.
When I first meet a patient, after they've done their consultation, either they're excited to come in and get their treatment ready and get going. Some come very nervous. Normally, they come in here and they think it's going to be an enclosed, such as an MRI, kind of a loud vessel. But we'll do anything to kind of keep them as calm as possible. So when they get on the table, usually we have our marks. We'll take x-rays. We want to make sure that we're in the right seat in the right row, not just in the ballpark. So we take our x-rays every day to make sure that we're within our specs. Once that's taken care of, then we actually leave the room. We have 2 cameras and an intercom, so we let them know when we're leaving. They know that there's eyes on them, so they're not really alone. The beam time is usually about 1 to 2 minutes, sometimes less than that. It's the prepping that takes time. It's the fact that they walk in and change, get on the table, and we take our x-rays. That's the time that's actually time consuming. Other than that, the beam time is actually fairly quick.
Some patients, depending on the disease type and the stages of the tumor, some radiation treatments can already have a positive effect on the tumor itself. Some cases take a few weeks to a few months, depending on the severity of the disease. In radiation therapy, we always follow up with PET scans and other diagnostic studies to prove to us that before you started your radiation, your tumor was this size. X amount of months after your radiation has been finished, we see a decrease in size, a regression of the tumor.
As a patient, you'll see me and my team members every day, but you do see the doctor once a week and the nurse once a week. They like to keep in touch and see how you're doing. They want to see if you have any questions, any comments, any concerns. So they like to keep in touch with their patients. So our side effects are very minimal here. It's usually fatigue, and that's a few weeks into treatment. And not everybody goes through that. Depends on how sedentary your lifestyle is. If you're a couch potato, then you tend to feel it very quickly. But if you're someone who's very active, that goes, works out and such, then you don't really feel it until probably towards the end, if that. The sparing of healthy tissue is a huge amount here. I definitely recommend proton therapy.
Any patient that's skeptical, it's always great to do your homework in all modalities. Come by the center, see the site, talk to some patients who's received proton therapy treatment. They will see that we have a lot of positives. We have extremely low side effects. We have a very pleasant staff and very thorough patient output.
When we come back, we get real personal with some of the graduates from HUPTY. Don't go away. We'll be right back. Welcome back to Your Health. We are wrapping up our day at the Hampton University Proton Therapy Institute, and we have learned so much. But what does it really feel like to undergo proton therapy? We spoke with a few HUPTY graduates and we'll hear their stories. But first, Let's hear how HUPD is fighting for coverage for prospective patients and veterans.
As we all know, cancer doesn't have a face. It doesn't have a ethnicity. It doesn't have a class. I think we would be hard pressed for anyone to find someone walking down the street who they themselves have not dealt with cancer or don't have a loved one, family member, or friend that's dealt with it. What most people may not know is the fact that cancer is now the leading cause of death in 22 states. So this is a huge issue that affects everyone. And here at the Hampton University Proton Therapy Institute, we're here to be a resource for every single person, no matter what they look like. Hampton University President Dr. William R. Harvey's main objective with establishing the Hampton University Proton Therapy Institute is to ease human misery and save lives. So that goes past just the treatment itself. We have dealt with some situations where prospective patients have to fight in order to receive proton therapy cancer treatment. Back in February of 2017, the Virginia General Assembly passed House Bill 1656. And that bill said that prospective patients could no longer be denied proton therapy solely based on cost. So now we have the legal leverage that we need to fight back against these insurance companies if they try to say, well, you know, there's not enough empirical data, or there's not enough evidence to show that proton therapy is not as effective as these other less expensive forms of treatment. When a person is diagnosed with cancer, I think they're in for a fight. They're fighting for their lives, and that's not, you know, hyperbolic to say so. So we try to do everything that we can to ease that human misery. We know that cancer has a huge effect on not only the physical, but the emotional and mental well-being of the patient as well. So we try to take on as much of that as possible. We actually have individuals on staff in administration and finance and medical records and intake who actually help with getting a patient through the initial phases to basically get on the table. So if there is a denial, we are able to fight on behalf of that patient, and we're able to help work out their appeal with the language that they need. If we look at proton therapy just from the full scope of it, cost or potential cost is one of the only real drawbacks. From a treatment standpoint and a reasonable person test, when you look at not only the cure rate that matches the other traditional forms of cancer, but also the quality of life that patients have, it's really a no-brainer. Money is the only thing that ever really puts it up for debate. So we try to do our best to make sure that if a patient has come in for a consult, they've been deemed someone who can receive proton therapy, that we provide them all of the avenues and outlets to do so. And we're willing to fight on their behalf to do that.
It is such a relief to know there are people here at HUPD who can help you deal with and understand your insurance options. We've heard a lot from the experts today, so let's see what actual graduates have to say.
My name is David Ellis. I'm a 5-year postgraduate from the proton therapy. I can tell you I was 58 when I was diagnosed, and it was probably the first major illness that I'd ever experienced. My doctor, upon diagnosis, because of my age of 58, the gold standard would be the surgery because of the potential for reoccurrence in the years to come and your mortality rate. For me, that just seemed too great a risk. I just felt that I had to do more due diligence than just act on the recommendation of my doctor.
I'm Gloria Cox. I'm a breast cancer survivor, and it's been over 2 years now. I was diagnosed during a doctor's exam. So the exam went well, except they suspected something, but wasn't sure, so that's when they recommended the 3D mammogram. Proton therapy was mentioned to me by one of my sisters. And then I asked questions to the doctor. The doctor did not recommend or anything. He said he couldn't, but he gave me great information.
When I learned of the Proton Center being built, I began looking into that. And fortunate for me, one of the first patients that came through the center here was a close friend of mine. And with that, he had very high recommendations for the center.
The initial visit was awesome. It was very relaxing. Things were just like people knew you already. you know, and they were so friendly. You felt like you were part of a family. So it made things really easy for me to make a decision. It gave me renewed hope. It gave me great hope, to be honest, that I knew what was going to go on was going to be, you know, fast and direct. You know, the information and the way they explained everything just let me know that I was not going to have any situations or any problems at all.
And the treatment itself it's such a short period of a treatment, actual each treatment, that, you know, there's a lot of, I guess, concern and fear prior to going in, but it's such a short experience to get up and it's like, wow, that's it. You know, knowing you have to keep coming back, and for me, it was going to be 42 treatments, but that first experience and the reassurance of the staff the whole time just was, you know, it was pretty phenomenal.
The treatments only took 2 weeks for me, and I was finished and over, and I was shocked about that because I was thinking, oh, it'll probably take a month, but no, it took 2 weeks, and I came like 3 times a week, Monday, Wednesdays, and Fridays. I
can tell you that my experience here has been phenomenal. The entire staff, from the very first appointment, the way I was treated, during treatment, the 3 technicians that were assigned to me were encouraging through the entire process. They became like family. That experience makes you feel that you're not going through this alone, not clinically, because they actually become friends, you know, for that period. And that's very beneficial to someone who's been diagnosed with cancer, to feel that they have that clinical support as well as family support.
If you think this might be a good option for you or someone you know, talk to your doctor. Remember, you are your best advocate. For more information about the Hampton University Proton Therapy Institute, visit their website or give them a call. I'm Lindsay Weller. Thank you for watching.